This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to the latest edition of Mon Health Live, the Mon Health Systems radio show where trying to enhance COVID-19 communication across the communities and get the information you need to know. David Goldberg not with us on this Saturday morning, but Dr. Crystal Atkinson is with us. Of course, Dr. Atkinson, Chief Nursing Executive of the Mon Health Systems. And Doctor, good morning. Thanks for coming on.
Thank you, Kyle. Good morning to you.
And our special guest this morning is Dr. Matt Schessler. He's orthopedic surgeon. And Dr. Schessler, good morning. Thanks for coming on.
Hey, good morning. Thanks for having me today.
We'll get the latest COVID information here in a moment, but Dr. Schessler, why don't you tell us a little bit about yourself, where you're from, and what your specialties are?
Sure thing. So I grew up in Charleston, West Virginia, and I did a residency in orthopedic surgery up in Pittsburgh, Pennsylvania for a few years, and then a hand surgery fellowship for a year up in Boston, Massachusetts. About 3.5 years ago, I came back to Morgantown and started working at Mountain State Orthopedics and with the Mon Health medical system to do orthopedic surgery. So my specialty, I'm board certified as a general orthopedic surgeon, but also board certified as a hand surgeon as well. And I do a lot of complex hand surgery.
Mm-hmm. Okay, Dr. Atkinson, let's go over the latest COVID numbers, what we know. The cases seem to still be declining as these vaccines are getting pushed out.
Yeah, that's absolutely right, Kyle. I mean, we have definitely seen those rates just continue to plummet, and we're excited about that. If we just take a few steps back a few months ago, we were in double digits from daily positive numbers. We are, as of this morning, we're sitting at a 3% positivity rate, which certainly is exciting to see, in addition to the vaccines that we have that are out now to help us with this fight.
Mm-hmm. And again, the vaccines are becoming more and more prevalent. It seems like with the additional doses that are available in the state and in the area, there's more places that you can get vaccinated. I know some of the independent pharmacies are involved now. So, again, it seems like more and more people are getting access to these vaccinations.
Absolutely, and we want to continue to encourage people. We can go right to the state website. You can go to our website at monhealth.com/coronavirus for all the information on how to register. It's very important that we just remind people that once you are registered, you're going to get a call back. So we want to make sure that you do pick up that phone so you can make sure that you get through the registration process so we can get you vaccinated.
Mm-hmm. All right, so the website is vaccinate.wv.gov, vaccinate.wv.gov. If you haven't already registered, you need to do so, and hopefully if you have registered, you'll be getting that call very, very soon. We've been through this together through the last year, and it's hard to believe that it's been a year, almost to the day that the shutdown started and the numbers starting to increase last March. The governor issued the state of emergency. I'd just like to get the thoughts of both of you. Again, you're in two very different positions, but still, as physicians, we've kind of just lived through this together. And Dr. Schessler, let's start with your thoughts of what's transpired over the last year or so and how it feels to kind of come through this thing. There's light at the end of the tunnel now.
Right, I am certainly glad that we're seeing a decline in cases from the spike that we had over the winter. I'm very glad to be part of the health system and with all the precautions they're taking. But I think that, coming out of this, that we've certainly seen some people putting off orthopedic procedures and putting off some care, and I don't think that that's necessarily a good thing. I've certainly seen some people in my clinic that they fell and broke their wrist or fell and broke their finger, didn't seek any care for it, and now they have a healed bone that's fairly crooked, and that makes it a much more difficult problem to take care of.
Mm-hmm.
There are certainly people coming in with worse injuries now than, had we not been going through COVID-19 and had people just come in normally as they had before.
Mm-hmm. Dr. Atkinson, your perspective on what we've all been through here the last year.
Yeah, that's an excellent point. As we continue to talk, week after week, we definitely don't want anyone to put off any medical care that they need. Our hospitals are safe, our clinics are safe, our practices, are safe. So, while it has been very challenging, we definitely have been doing everything that we can be doing to keep everyone who needs any type of medical assistance safe as you come into any of our facilities.
Mm-hmm. Dr. Schessler, you talked about people perhaps being injured, a slip on the ice this winter, and they delay that orthopedic care. What would your instructions be? What would your advice be now for those who may need that orthopedic care or perhaps a follow-up on an injury?
Yeah, I think if you've injured yourself, I think you should come to the doctor and get things looked at, because there are certainly injuries that, if they are not treated the right way early on, can certainly be worse. And I think that, letting a broken bone go without the appropriate care is not a good thing. And I do think, to echo what Dr. Atkinson said, we follow the CDC guidelines as far as mask requirements, as far as social distancing, and trying to keep people safe that come into our office to get taken care of.
Mm-hmm. I know one of the things you work with, or one of your specialties, is outpatient joint replacements. Talk about that a little bit, and how someone might determine whether they're a candidate for that.
Right. So with the joint replacement, those are typically done for things like knee arthritis, hip arthritis, or shoulder arthritis. We have 6 surgeons in our group that all perform outpatient total joint replacement in those areas. And so joint replacement is, we are one of the only facilities in West Virginia that offers outpatient total joint replacement. And this is a procedure that you have a discussion with your surgeon. So in order to have an outpatient joint replacement, you have to be physically in good shape, because, after your surgery, you're going back to your house to recover, so you have to be able to, make sure you get around. You have to be pretty healthy to do it, and we have to make sure that you're not at risk for medical complications. This is a discussion that typically is between the patient and their surgeon as far as whether they're appropriate for it, but I think there's a good number of people that benefit from outpatient joint replacements, and it's certainly a good thing to ask your surgeon about.
Mm-hmm. Is this something that's fairly new?
So in West Virginia, it is fairly new. I believe we did one of the first outpatient joint replacements back in October of 2020. But around the country, this is not a new idea. It's been done for several years. In many states, there's a very good safety record of it, all published in the medical and orthopedic surgery research, that this is a safe way to do total joint replacement.
Mm-hmm. And obviously this is advanced. I mean, it's kind of incredible to think about a total joint replacement in an outpatient scenario. What are the advancements? What are the things that have made this possible here, at least in West Virginia recently?
Well, I think so. One thing is the anesthesia that is done for these. So there have been advancements in what are called nerve blocks. So a nerve block is, I would think of it like, when you get stitches in your hand, you numb it up with some numbing medicine. That can be done on large nerves in the leg in order to limit the pain signals, but not necessarily affect the muscle signals that you need to be able to walk after your surgery. Some of the nerve blocks can last and give pain relief, sometimes for a few days. And that has really helped us be able to do joint replacements on an outpatient basis, is that people are comfortable after they have them. They're not in a lot of pain, but they're still able to walk and take care of themselves and get around afterward.
Mm-hmm. All right, so what determines if someone's a candidate for this? How would they learn more? How would they get a hold of perhaps someone in your practice to determine if they're a candidate?
Yeah. So I think that first and foremost, being strong from a physical standpoint and being healthy from a medical standpoint are two things that you have to have. Those are usually when you see your surgeon in the clinic, that's a conversation you have and you make that decision together. And then in order to get into the office, we have people give our office a call. We're happy to get people scheduled to get looked at and evaluated. We do have an online video on the Mon Health website. We do something called a joint camp, which is people that are going to have outpatient joint replacements. We see them, in a group setting a few weeks beforehand. They speak with the anesthesia team. They come to the surgery center, speak with the surgery center staff about what to expect. And we do have we do have a video of that proceeding online as well that people can look at to get an idea of what it's all about.
Mm-hmm. We are with Dr. Matt Schessler. He is with Mountain State Orthopedics. And, of course, Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems. We need to take a break here, but Dr. Schessler, I would imagine the full COVID-19 protocols are still in place for your facility. Can you explain to people what precautions are in place if they do come to your facility?
Yes, sir. We do follow the CDC guidelines. Everyone in the facility is wearing a mask indoors. We do all the cleaning expectations and follow the CDC guidelines between patients as far as equipment that may be reused. We do, as far as people coming into the facility before surgery, we do check people for COVID-19 to ensure that they are negative so that we can prevent it from even coming into the facility. People that are having symptoms, we certainly would ask that they get tested and not have symptoms before they would have a procedure done. We also do, within our waiting rooms, we do social distancing within the waiting rooms. When we were having the COVID-19 spike, we were asking family members to wait in their car instead of in the waiting room. But now that the numbers are declining, we've changed that, and one family member is allowed to wait in the waiting room as long as they're wearing a mask and following social distancing guidelines.
Mm-hmm. All right, this is Mon Health Live for this Saturday morning, and we thank you for joining us. Again, we're talking with Dr. Matt Schessler with the Mountain State Orthopedics facility and Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, is with us. We'll continue the conversation. Again, Mon Health Live for this Saturday morning, 104.5 FM, 1440 AM, WAJR, and we're back in a moment.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
David Goldberg off on this Saturday morning. Dr. Atkinson is with us. Dr. Matt Schessler, Mountain State Orthopedics, with us as well. And Dr. Atkinson, we heard from Matt there about the protocols that are in place at his facility. Of course, more and more people are getting vaccinated, and there may be a tendency perhaps to relax a little bit, but I know at Mon General Hospital, all of those pretty stringent protocols are still in place to keep people safe.
Yes, absolutely. And we want to make sure that we do also keep in mind that this is not 100%, right? So we've got 95% efficacy, which is wonderful, and that's keeping us from getting severely ill. But we also don't know that population who are immunocompromised, and we want to make sure that we continue to protect each other, protect our patients, protect our visitors. So we're still screening, we're still masking, and we're still, at this point, just limiting to one consistent visitor. And if there's special needs, of course, we take those on a case-by-case basis.
Mm-hmm. Again, with the vaccine, and we talked a little bit about this in the first segment, it seems like the emphasis is to get the most vulnerable population vaccinated, and I think we've had pretty good success in this area with 65 and over being vaccinated, and now, again, more and more people. I believe the threshold down to 50 and older. I know just about everybody in your facility at Mon General has been vaccinated, so we are making progress in that regard.
Absolutely, and we just continue to encourage people, especially as you just stated, Kyle, the age limit has now gone down, just to go on, make sure that they're getting registered so we can get folks vaccinated.
Mm-hmm. Dr. Schessler, as we talk more about the orthopedic aspect here, weather, of course, is getting warmer. It's spring. We had some wonderfully warm 60, almost 70-degree days this week, so people are getting more and more outside. They're doing more outside activities. Injury prevention, that becomes important at this point.
It sure does, and I think there's two ways you can think of injury prevention. One is, you're outside, you're running around, you're climbing on rocks, climbing trees, all those things. A very common thing that we see are falling and breaking bones. So I think, one way is just be careful with what you're doing, have good shoes on, have the appropriate equipment, take the appropriate safety precautions for the activity that you're doing. There are some, COVID-19, I think, hit the gyms and the fitness centers pretty hard. They were closed for a while. As people are getting back into things like regular exercise, I think that one way to try to prevent injury is to gradually get back into the swing of things. You can't just, if you haven't done something for several months, you're not just going to be able to get back to the level that you were at. And it's certainly easy to hurt yourself or to get an overuse type of injury by just jumping in full speed ahead instead of gradually advancing your activity back to that full level you were at.
Mm-hmm. I think we're going to see golf increase. We're going to see tennis increase. We're going to see people out walking and jogging. This is good, though, because, man, it was a long, dark, cold winter, and it's just good to see people out again.
Sure is.
All right. For those who did delay care, like you said before, they suffered a fall on the ice, or they tweaked a shoulder or knee or something. Obviously, those people, they need to be treated now. What about chronic conditions? Do you have tips for people who have just kind of been achy and in pain during the winter?
Yeah, so I think that, I think first and foremost, number one is figure out what you have and what we're dealing with. Aches and pains come in all shapes and sizes. Sometimes they're from arthritis, sometimes things like tendonitis. But I think it's important to get in the office, get your joint looked at, where it's hurting, what started it. Sometimes an X-ray is needed. But I think first and foremost, figure out what you have. That's how we start with treating the chronic condition. And, I think after the long winter, we do need to get people in and looked at. I think it is safe to be in the office. I think everyone's taking the appropriate precautions. And, I think if you've been hurting for a while, you deserve to have your problem treated and deserve to get it looked at. And I think that's the first start to kind of helping treat these chronic conditions, helping with pain, and getting people back to what they want to be doing.
And take a look at that joint camp video. It's online at modhealth.com/ortho. People can get a sense as to how your type of medicine has advanced.
Yes, that's correct. That's an excellent video that can give people a sense of what an outpatient joint replacement is like, and they can get a sense of what the steps are, especially on the day of surgery, and what to expect afterwards.
All right. We've got about 2 minutes left in the show. Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, is with us. And Dr. Atkinson, again, it's been a long winter, and people have been cooped up because of this pandemic and because of the weather. If they don't have a primary care doctor, it's important not to lose sight of overall health. What would you recommend to those people, again, who after this long winter just need to be seen, need to get the checkup?
Yeah, definitely don't put off your healthcare needs. As we have talked about it today, you need to make sure that you're getting the help that you need. On our website at monhealth.com, there's an area where you can choose your physician, and we have wonderful primary care physicians that will be willing to take on new patients.
Mm-hmm. And again, the vaccine is very important. More and more people, hundreds if not thousands of people in the county and in the state are being vaccinated each and every day. but it's not time to relax yet, right?
Absolutely.
Okay, so what do you recommend for people, again, to continue to keep themselves safe as we hopefully are coming towards the end of this pandemic?
Right. First and foremost, definitely make sure you're registering for your vaccination, whether it's one shot, 2 shots, etc. Make sure you go through the full process. Secondly, continue with the processes that we've had in place, making sure that we're masking appropriately, especially when we're out in public, making sure that we are socially distancing, washing our hands. And if we're starting to feel symptomatic, again, if you do not have a primary care physician, go to our website and pick from the many very capable physicians that we have. Or if you already have your primary care physician, please make an appointment so that you can go and see them if you have some needs.
And if you have those symptoms, the testing's still available too, right?
Testing is definitely available. We run that during the week and on the weekends.
All right, very good. Guys, great information. Dr. Schessler, anything you'd like to add here in the final 30 seconds?
I think Dr. Atkinson hit it spot on. If you're having problems, get those taken care of. Stay vigilant with the vaccines and the precautions, and let's get through this pandemic.
Yeah, almost. We've got to spring. It's nice to be outside. It's nice to hear the birds. It's nice to see things in bloom, and it's just nice to get that fresh air. So we've gotten to this point. We've gotten through the winter and gotten to the spring. Dr. Schessler, thank you for your time this morning. Great information.
Thanks for having me on. I appreciate it.
Dr. Matt Schessler with Mountain State Orthopedics, and Dr. Atkinson, again, thanks for your time as well. We'll talk to you next week.
Okay, thank you, and enjoy your weekend.
Very good. Dr. Crystal Atkinson, Chief Nursing Executive of the Mon Health System. That's Mon Health Live for this Saturday, 104.5 FM, 1440 AM, WHAR.